If I've got somebody coming in saying they have pain in their knee, how does that present with patellofemoral issues? How do they present? What are they telling you when they come in with patellofemoral issues?
Pain.
Popping under the knee, crunching, grinding maybe.
Pain at a specific point or motion.
So what motions are going to bother them? What activities? What functional movements?
Running, squatting.
Running potentially?
Stairs.
Stairs when they're bending and then loading coming up, or they're taking that load coming down, eccentrics. They're going to have a lot of pain. So what are we going to do? What do we want to see when we start talking about dynamic versus static stability? What are we looking for in assessing that? That's when you get in the conversation, you start a second. So what are you looking for in, we look for that patellar tracking. So we start with just its position, high, low, whatever. But then we need to move into a functional range. So one idea you have, one theory. You take the quadricep muscles as they come down into the patella. Ideally, they're all equally strong. So Fernando, step up for me. No, you're always right there. What are you going to do? So if you and I come up and we each grab the table on one end, one side, and we pull together, because we got toys on it, it's going to move evenly. So translate that into the quadricep on top of the patella. If the VMO and the vastus lateralis are pulling bilaterally, evenly, then that patella should track fairly evenly. But something very unique happens, and you can see, something very unique happens when you start changing the Q angle in that the vastus lateralis, as we've discussed in functional lab, becomes far more toned, strong, used than the VMO does in many females because of the increase in the Q angle. So what does that change that storyline to? So that vastus lateralis is going to be pulling with two hands where the other one's pulling with one.
Muscle imbalance.
There's a massive muscle imbalance between the two. Now there's questions about how much this really, A, influences patellar tracking, and B, is correctable. Because take a minute looking at your own body. Can you contemplate exercises that isolate the VMO at a level that you can actually gain strength? You've got a hinge joint to work with. So that's really kind of limiting the ranges of motion. It makes it difficult to do much. There are some things you can do that help, and I would probably include that into my rehab plan. So that muscle imbalance, I mean, I think probably has some degree of influence over that patellar tracking. What else can influence that patellar tracking? There's a whole other structure that we didn't quite talk about much. Your IT band runs along the lateral side. It actually has capsular connections, ligamentous like retinaculum, that's connected up to the patella. So if this is tight, then there's going to be a little bit more of a lateral shift, lateral pull, which accentuates with that vastus lateralis being stronger. So add the Q angle into that. So if you drop your knee in and then you're bending, that's even more going to start pushing that kneecap into the lateral side. So there's quite a few things. Some of that we can do something with. What can you do with a tight IT band? Man, the other person on a foam roller, mechanically stretch it out. Stretch them by stretching them with your hands. Foam rollers do wonders for that. We can work on trying to isolate the VMO. But what I really like doing with these people is working on that functional dynamic aspect. Trying to see what we can get out of identifying where those deficits are. And I see them much, much easier with video.
gives you 10 minutes, right?
So, let's try the one we picked on today. There are 3 exercises that I think do a whole lot towards seeing problems. It's a pretty quick and easy drill. You put a small hurdle and you ask them to jump over and over and over and over and over and over. This individual has no pain, no problems. So in something like this, outside of the clumsiness of continually kicking my hurdle, what are you looking for with this? What do you think we want to see with the conversation we've been having?
Bilateral symmetry?
Symmetry for sure. I want to make sure that those knees
Stay together.
don't keep dropping in. I want to make sure they stay evenly apart both on takeoff and landing. Foot position, I want to make sure that foot position really is consistent. Sometimes you'll see a little bit of torsion torquing out to where their hips rotate some. But if that happens too much, you'll start seeing those hips drop a lot as well. So small leg hurdle jumps are one. The next that I like are just straight lunges. So what are you looking for with that? Same kind of ideas. Say it again.
That knee coming in.
That knee dropping across. One of the first things I look for is the position of that knee, because if it starts dropping in across the midline of the body, then we have issues. Because that's going to immediately mean that patella is not going to have a stable base to work from. Because unless that hinge joint is working properly and staying in the same plane, that patella riding on top is going to be forced to one side or the other. So, walking lunges are a great second step. And my third are squat jumps. There we go. So what I want to see with squat jumps is that on takeoff, the knees stay even. On landing, the knees stay even.
He's got a bit of little external rotation.
So he's got, there you can see, you can start seeing. When you fatigue somebody a little, you'll start seeing where some of those differences are.
Yeah, like right there.
Right there, yeah. You can see it for sure on that last one. So, let's move that back to seeing somebody who we know has issues. Complaining of patellofemoral problems, and see what this looks like.
Start videotaping my
Let's start doing.
So what do you see now?
She has to rotate her legs out.
You can see like almost like the feet kick out to the side to get over because she's not lifting up straight to go over the hurdle. So what's going to happen is if you take somebody who has a very strong vastus lateralis and they have a weaker VMO, their body is attuned. It knows that. So it's going to get the leverage where it can. So it's not going to get leverage and strength from going straight down. It's going to get it by preloading just the vastus lateralis. So their tendency is to drop the knees in further to get the leverage and the preload on that vastus lateralis. So you'll see the knees drop in or the feet rotate out as they jump over a hurdle.